Part A of Annex I to Regulation 1223/2009 lists 10 sections of safety information a cosmetic product safety report must contain, as a minimum. Part B is the assessment built on them. Every one of the 10 has to be answered. Almost none of them names a test, and what decides whether you need a laboratory is not which section you are on. The guidance puts that call with the safety assessor, whether the available data are sufficient or whether additional data need to be obtained on an individual substance or on the finished cosmetic product. The report shall, as a minimum, contain the following. That sets the floor for what has to be in the report. It does not describe everything a particular product may need. The Commission's guidance on Annex I Implementing Decision 2013-674 EU says any discrepancy with regards to the requirements of Part A should be justified, and it sets the condition on that. Depending on the type of product, the safety assessor or the responsible person may consider that some of the required data are not relevant or necessary. Where that happens, the absence is to be clearly justified in Part A, and the justification is to be repeated and validated by the safety assessor in their reasoning in Part B. So a gap is not a free choice. It is a claim that the data was not relevant or necessary for this product, and someone qualified has to validate that claim. On that, the guidance is explicit. The data required by Part A can be drawn from any reliable source. Examples include data from suppliers, scientific literature, experience gained with similar or other product categories, results of studies on the product itself or on the substances it contains, available data on similar formulations or computer models. Examples: the list is not closed. Reliable is doing as much work there as any other word. The guidance asks the report to highlight the relevance of the data in relation to the product and asks the assessor to consider the quality and limitations of the studies used. On the toxicological profile specifically, the regulation goes further than the guidance. Annex I Section 8 says any read across shall be duly substantiated and justified, and that the source of information shall be clearly identified. Shall, not should. And there, the guidance asks the assessor to ensure the experimental data complies with Article 18 on animal testing. Safety and quality data may be on file with your raw material suppliers, and the guidance says the supplier should share it with the manufacturer of the cosmetic product. Worth asking for before you book anything. Where existing data runs out is where the question turns on your formula in your packaging. Even there, the guidance notes that experience with similar formulation and packaging combinations already on the market provides useful indications and that additional testing may not be required, while adding that more evaluation may be needed for new or novel packaging. Annex I Section 2 asks for the physical and chemical characteristics of the substances or mixtures and of the cosmetic product, and the stability of the cosmetic product under reasonably foreseeable storage conditions. Reasonably foreseeable describes the storage conditions the study has to cover. It does not describe where the study happens. Neither instrument says anything about that. The guidance asks for the methodology used to determine minimum durability, the tests specific to the stability study, and the results of those tests. Alongside them, 3 further items. Evidence that the composition of the product used for stability testing corresponds to the product actually placed on the market. The results of the preservative efficacy study, for example, a challenge test, if applicable. And, when applicable, the period after opening and its justification. The first one catches people. A study run on a composition that was later changed does not on its own satisfy that requirement. The SCCS recommendation quoted in the guidance is that relevant stability tests, adapted to the type of cosmetic product and its intended use, should be carried out, and that physical stability tests are carried out with inert containers and those intended to be used on the market, both, not one. Annex I, Section 3 asks for the microbiological specifications of the substance or mixture and of the cosmetic product. It says particular attention shall be paid to cosmetics used around the eyes, on mucous membranes in general, on damaged skin, on children under 3 years of age, on elderly people and persons showing compromised immune responses, and it names results of preservation challenge test. The guidance sorts products into 3 categories by microbiological susceptibility. Low microbiological risk products. The examples given are products with an alcohol content above 20%, products based on organic solvents, and high or low pH products. For those, neither a preservation challenge test nor microbiological quality tests on the finished product are necessary. A scientific justification is to be provided. Single-use products and products which cannot be opened. The example given is packaging that allows dosing the product without it coming in contact with the air. For those, only microbiological quality tests on the finished product are necessary. A scientific justification is to be provided. All other products, both a preservation challenge test and microbiological quality tests on the finished product, are necessary. 2 things worth being exact about. The second category still requires a test result on the finished product. It drops the challenge test, not the microbiology, and the categories turn on the product's microbiological susceptibility, not on the shape of the container. Whether a water-based emulsion in a jar you open falls in the third category depends on its actual properties, its pH, its alcohol content, its solvents. The guidance names water-based mixtures among the materials most susceptible to microbial growth, so most will land there. But a justification for the first category has to be scientific, not preferred. Sections 6, 7, and 8 are where the report stops describing and starts calculating. Section 6 is exposure to the cosmetic product. 6 named elements covering where, how much, how often, and to whom, plus specific populations, secondary exposure routes, and particle size. It is calculated from how the product is used, not measured in a lab. Section 7 is exposure to the substances contained in the cosmetic product for the relevant toxicological endpoints, taking into account the information under Section 6. Section 8, in the regulation's own words, without prejudice to Article 18, the toxicological profile of substance contained in the cosmetic product for all relevant toxicological endpoints. A particular focus on local toxicity evaluation, skin and eye irritation, skin sensitization, and in the case of UV absorption, photo-induced toxicity shall be made. Article 18 is the animal testing provision. It sits at the front of that sentence for a reason. Relevant is the other load-bearing word. The guidance puts the final decision on which endpoints are relevant with the safety assessor on a case-by-case basis and says that where a certain endpoint is considered to be not relevant, this should be justified. Then the calculation. All significant toxicological routes of absorption shall be considered, as well as the systemic effects and margin of safety, based on a no observed adverse effects level, which shall be calculated. The absence of these considerations shall be duly justified. Where no such value is available, the guidance allows other reference toxicology values to be used, where justified. On the number itself, the guidance says it is generally accepted that the margin of safety should be at least 100. That is accepted practice, the guidance records. The regulation requires the calculation and sets no figure. This is a risk assessment, not a test result, which is why Part B has to be carried out by a person holding the qualifications Article 10, Paragraph 2 sets out. A formulator who holds them qualifies. A formulator who does not, does not. Sections 1, 5, 9 and 10 are description and record keeping, composition and intended function, normal and reasonably foreseeable use, undesirable effects, and any other relevant information. Section 4 is the one that gets misread as paperwork, impurities, traces, and packaging material. The purity of the substances and mixtures, evidence of technical unavoidability where traces of prohibited substances are present, and the relevant characteristics of packaging material, in particular, purity and stability. Supplier data is preferred here, and the guidance says so. But it also contemplates physicochemical analysis of possible impurities in raw materials and, if necessary, in the final product, and studies on interactions between the formulation and the primary packaging. So Section 4 can need a laboratory, so can Section 10, whose named examples include existing studies from human volunteers. No order of work is set anywhere in the regulation or the guidance. This one follows from what the report needs. Finalize the formula. For stability, the guidance is explicit that the composition tested has to correspond to the product actually placed on the market. Ask your suppliers for the safety, quality, and purity data they hold, because the guidance says it should be shared, and because it tells you early whether a substance is going to be a problem. Work out with your assessor which microbiological category your product falls into before you book anything. Then run what is left. Stability in inert containers and in the market packaging. The challenge test where your product needs 1. Microbiological quality on the finished product where it is required. What is fixed is not the order. It is that every section has to be answered, and that an answer of not relevant, not necessary, is one the assessor has to validate in Part B. If you need the testing side of this done, the link in the description is where to start. This is the Cosmetic file. This channel is supported by MySwissLab. Educational only. Check with a qualified safety assessor for your own product.